Good morning, everyone. Happy Friday. Thank God it's Friday, TGIF. We're here this morning with Dr. Steven Cyr, medical doctor here in San Antonio. We've interviewed him once before, but by popular demand, we're bringing him back. There's some additional questions from last segment that we had about maybe 3-4 weeks ago that we want to cover, and additional questions that you may have while we're live to interact and ask away when it comes to it. So welcome this morning, Dr. Cyr. How are you doing?
Thank you. I'm great. How are you?
Great. One of the things as far as MD Monthly, and I want to ask you this question first of all, the importance of getting this type of information out there. What do you think is important? Why should patients know what's going on as far as preventive health care, back pain, and everything else?
Well, I think there's a lot of information that people are exposed to, whether it's from their doctors, their friends. You know, a lot of people have experience with family members, especially who have had back problems. And I think specifically for the back, it's important to have information that's coming from a credible source. You can go on the internet and find a lot of things that may or may not be valid. So you have to make sure that you're ferreting through that information and that you get appropriate information. Also, everybody's personal experience is different. You want to make sure that you don't assume that because your friend had this issue or they have this problem and this treatment that yours will look the same. So I think it's important to hear from someone whose specialty is in a field that a lot of questions surround, and spine surgery is certainly one of those.
Well, hence why we have it, call it Ask the Expert. And I appreciate your time this morning as far as bringing this forefront to as far as medical information. You know, being a validated and reliable resource is very important. And you're right. I mean, you can find anything on the internet, but all of a sudden you're going to die tomorrow sometimes with some of the symptoms that you find. But you don't want to get misdiagnosed or self-diagnose yourself. You want to hear from the expert itself.
Yeah, that's true. That's true. There's a lot of stuff out there, you know, and you have to also know who to go to. Sometimes as a patient, you're not really sure who to go to. Mm-hmm. And I think it's important that you look at the background of anyone you see. I think people do a lot more research on their car purchase than they do on their physician. So I think it's important that you look at the background of anyone that you're referred to or anyone that you consider seeing so that you can have hopefully a credible person taking care of you. And most doctors, if not all, are in this for the right reason. And I think that everyone doing the practice of medicine is certainly doing everything they can to make a difference in this world for the positive. But there's different tiers of training, there's different levels of experience, and there's just frankly different skill from person to person. And no matter what your specialty is, there's a bell curve. Yep. And whether it's in medicine or any other kind of profession, there's a bell curve of performance, and you want to make sure that you are on the far end of that, on the positive side, so that you're not subjected to potentially failed treatments.
Well, let's get started this morning as far as the questions that we were left off about a month ago and that I want to go ahead and transition in today. Okay. And I'll get in the meats and potatoes of it when it comes to these questions. We had a viewer last segment asking what's the risk of paralysis when it comes to spine surgery?
That's a pretty common question from patients. I think that first of all, everyone has to know that the basics of anatomy when it comes to the spine is that in general the spinal cord ends at the L1 or L2 level, which is the uppermost segment of the lumbar spine. So any surgery done from that level down is zero risk of spinal cord injury because the spinal cord no longer exists. The spinal cord transitions into a segment of nerves that are stuck together in a sheath called the dural sac. It looks like a long thin tube, and that's what conveys the nerves from the end of the spinal cord into the lower extremities. And those individual nerves then exit in pairs below each bone, and based on where it exits, that's what we label the nerve. But they're individual nerve roots and rootlets, so you're unlikely, if not, it's actually no risk of spinal cord injury. However, so that's paralysis. However, you can have a nerve root injury or several nerve roots injured, which would lead usually to one or two motor nerve abnormalities where you can't lift your foot slaps on the ground, your leg is collapsing. So you can have weakness in a specific motor group of muscles, but paralysis is not possible at all. There's about a 1 in 1,000 risk of having a nerve root injury, and there's about a 1 in 10,000 risk of having a problem that where the control of the bowel and bladder becomes affected.
When you have these people coming in or are there phone calls to schedule an appointment as well, is it because of lack of exercise? Were they in a car wreck? Or what's happening? The preliminary process to actually their back is hurting.
Why are most people here?
Yes.
You know, in general, I'd say most people come to see us because of arthritic changes. You know,
okay.
One thing that a lot of people don't understand is what does the term or D terms degenerative disc disease mean? A lot of people hear that and it actually sounds pretty scary. Oh, I was told I have disintegrating or degenerating discs. And the truth is, a degenerative disc disease is just a catch-all phrase for arthritis of the spine from wear and tear. It's arthritis of the spine. So whether it's in your neck, your mid-back, or your low back, degenerative disc disease is arthritis of the spine, and it's a wear and tear type of arthritis. There's a lot of different forms of arthritis, but degenerative disc disease is essentially osteoarthritis. It's one from age and it's one from wear. So degenerative disc disease is a relatively common thing. By the time we're in our 60s, about 95% of the American population has arthritis of the spine or degenerative disc disease. And the truth is, between 35 and 45 years old, if you took a random sampling of the population, sent them for an MRI, and these are people with no pain, 35% of them between that age group will have arthritic changes in the spine. So having degenerative disc disease is not necessarily the worst thing in the world. What really matters is, what is that degenerative disc disease doing? Has it resulted in incompetency of the spine? Has it resulted in compression of the nerves? And of course, has it resulted in severe pain? And if the nerves are compressed, of course, there's a whole host and constellation of symptoms that can follow that. You can have numbness, tingling, weakness, pain. You can even lose a thing called proprioception, where you lose the ability to sense your limb in space. So I know my leg is extended, my eyes are closed. Oh, wow. That's also a nerve function called proprioception. So those things can all be damaged when a nerve is compressed. So
even as far as hasn't have to deal with just only age, but so former athletes as well.
Athletes, football players, rodeo guys. I mean, usually people that are in ejection seat aircraft. So when I was active duty, a lot of our ejection seat, the fighter pilots had really terrible arthritic changes. A lot of them in the neck because of the helmet, motocross, and anyone who puts their body through the rigors of athletic trauma. Because a lot of times our athletic injuries are repetitive. You constantly are loading the disc, you're constantly loading the spine, and the same thing happens to our joints. The spine is a rudimentary, the disc between the spine is a rudimentary joint, right? There's not as much motion as our wrist, our elbow, our shoulder, but there's still some motion there, and when those discs and that padding between our bones is compromised, you start losing the structural integrity of your spine.
Interesting. And thank you so much for this information. I have some other questions from the last segment as far as one is in particular. This question is asked a lot between the difference between an orthopedic spine surgeon and a neurosurgeon. What exactly is the difference, and why should one call another?
Well, I would say that there are two types of surgeons whose foundation allow them to be credible, safe, hopefully talented spine surgeons, and that's both neurosurgeons and orthopedic surgeons. In general, spine surgery was created by orthopedic surgeons. Neurosurgeons have become very prominent in the spine world because a lot of what we do in the spine is working around structures that surround the nerves. Now, most spinal conditions don't involve the nerves. They usually cause a problem from outside the nerve in, pushing in on the nerves. And so what people have is nerve-related symptoms, but we're not usually fixing a nerve problem. We're fixing something that's externally creating an issue with the nerve. So neurosurgeons have become more prominent in the field of spine surgery. But I would say in general, you need to go to someone who's fellowship trained. My strong preference is, and there are doctors out there that have been around for a long time that do credible work, that are talented surgeons. There's definitely a couple in San Antonio that do good work, that have been around for a long time before the advent of the fellowship. But fellowship training is extra training where one specializes in a specific subcategory of a specialty in medicine. So if you're interested in spine surgery, your foundation can be orthopedic surgery or neurosurgery. But if you have someone who then goes on to additional training that specializes and focuses only on the spine, you're more likely to get someone with the top tier training and the ability to give you probably the best answers in this category of injury and diagnosis.
Well, that's good to know. Thank you for answering that question as well. Opposed to me having my phone and trying to read it like I'm texting somebody, I'd rather just ask Miranda, who's across. She's reading the questions that are actually coming in.
Okay.
But go ahead, Miranda. What questions do we have coming in?
All right. Do you think there's any correlation with the spine and tinnitus? I believe that's how you say it.
So Miranda asked, one of our viewers is asking if there's a correlation between ringing in the ears, that's what tinnitus is, and the spine. And there's a lot of stuff that can happen where people get a sensation of abnormal neurologic issues where it's more cranial based. So things that in the head, there are a lot of cranial nerves that control our facial function, and there are sensory nerves that go to our face. A lot of times when people have upper cervical issues, they can have abnormal nerve function that doesn't necessarily match our map. So there's a potential for that. Typically not, though. Typically tinnitus comes from something in the inner ear or something maybe in the back of the brain near the mastoid process, where it can cause a ringing sensation in the ear. So in general, I would say no, but if you have those symptoms, the first person I would see is an ENT doctor, and then if those symptoms are looked at and there's no clear cause or source in the ENT's eyes, then I would then seek out someone, especially if it's associated with neck pain or pain in the base of the skull. And then one more thing about neurosurgery and orthopedic surgery, just the final thing is, some surgeons like me actually have training in both. My fellowship training at the Mayo Clinic was actually a combined neurosurgery and orthopedic surgery of the spine fellowship. So I had mentors from both fields, both disciplines, top in the world, training me how to do spine surgery. So that I really appreciate that opportunity. It was a huge blessing because I have both perspectives as a spine surgeon.
Let me ask you, you mentioned Mayo Clinic, okay, and to the general public as myself, Mayo Clinic, what does that mean actually as far as, being...
Well, Mayo Clinic is one of the top tier programs in medicine across all fields. So if you look at U.S. News and World Report and you try to gauge where are the best programs in the country or in the world, they usually will rank them based on a host of categories. One is patient outcomes, satisfaction, complexity of surgery, what types of conditions they treat. One is research dollars. One is, just reputation, research, publications, those types of things. And so they're ranked. And the Mayo Clinic for both neurosurgery and orthopedic surgery and numerous other fields has been rated #1 in the world for many, many years. And there are some really top tier programs like Johns Hopkins, Harvard is up there, but there's a battle between them and Hospital for Special Surgery, but there are some really good programs. The bottom line is that if you're looking for somebody's training, you want to try to find somebody who has trained somewhere where if you have a complex condition especially, where complex treatment is part of the regimen. And so the Mayo Clinic is a really well-known program, and it was started in Rochester, Minnesota many years ago by two brothers who wanted to make medicine family style. They wanted to treat patients like their family. And if you go to the Mayo Clinic, you would be amazed at the humility and the compassion of these amazing world famous doctors. You don't see that often in the field of medicine, where doctors that are that talented are that humble.
Well, that's good to know, because there's some questions that I may want to ask, and thinking as a viewer or as a patient that, forgive my ignorance, but then again, I want it to be a little bit more elaborate as far as the Mayo Clinic, so it's really, the validation is very important. I'm glad you mentioned that as well. I believe we have another question from a viewer. Again, thank you for watching us on mdmonthly.com and MD Monthly Facebook. But Miranda, what do we have?
Do you have any suggestions on what I can do to make sure my back stays in the best condition possible?
Sure, that's a very common question. So Miranda's asking for the viewer, are there any suggestions about keeping your back healthy in general? And not too long ago, we published an article for MD Monthly about exercises to improve back health. And one of the most important things, especially as we get older, that people ignore is flexibility. And so I always tell my patients, one of the most important things you can do is keep your core muscles strong and your supporting muscles flexible. And the supporting muscles for the spine are numerous. They begin at the chest and they go all the way down. So, remember that old song, the knee bone's connected to the hip bone? That stuff is true, because what happens is our body is a machine. We are a mechanical device. And if anything is thrown off kilter, if we're too stiff in one muscle group, too flexible in one muscle group, if we're too weak in one muscle group, if you have an imbalance of muscle pull across your spine, and that starts from your back down, then you can have back pain. So I highly encourage people to do exercises like Pilates and yoga that focus on strength and support around our spine, our pelvis, our legs, and also focuses on flexibility. And then I also like low impact exercises. I like weight training. I think weight training is underrepresented in the field of medicine, in the field of exercise nowadays, because it's kind of an old school way to get your body in shape. But weight training is actually very effective in not only improving muscular support, but also in providing strength to the bones. A lot of people don't realize that when we lift weights, we actually increase the density of our bones. So especially as we get older, that whole risk of osteoporosis, we can actually start to minimize the risk if we're lifting weights. So weight training is good. Elliptical, swimming, cycling, Pilates, yoga. Those are the exercise regimens that I typically recommend for patients with spinal conditions.
I love it. You know what, and to compliment you too as well, your representation, you physically fit, you practice what you're preaching as well too. And it's very important for surgeons to apply what they're actually preaching to their patients as well. So.
Yeah, a lot of people don't realize that spine surgery is actually a very physical surgery.
Mm-hmm.
We do surgery, and we have to stand for hours on end. We usually wear lead aprons. We're leaning over a patient. We're putting in screws manually. We're stabilizing the spine. We're moving muscles. So we're doing things that require manual strength and stamina. So, I do have to practice what I preach, because if I'm not in shape, I'm not able to do effective surgery. Even when we're doing an operation, if you don't have the muscular strength and the stamina to do these operations, it may even compromise the way you do surgery, because you're not physically able to do the surgery in the right manner.
I think we have another question coming in. Miranda, shoot that question.
There are so many people that suffer from back pain. How do you decide if it's time to come see a doctor like you?
I would say in general, if you are exercising on a regular basis, if you're stretching and you're building, and your back pain is refractory, it's not effectively being treated by those just mild, conservative, everyday regimens of exercises, then it's probably not a bad idea to see a spine surgeon. And the truth is, a spine surgeon who is credible is not going to recommend surgery for most people, because the truth is 80% of the American population will at one time experience at least one episode of severe debilitating back pain. These are very well-known statistics. But not everyone needs surgery. For example, in our practice, we see between 400 and 500 patients a month. Well, I do surgery on about 20 out of those 400 to 500. So the vast majority of what we do is conservative care. We're recommending exercise. We're recommending specific treatment. But you need someone who has the know-how to identify where the source of the pain is, because the spine is a very complicated structure. A lot of times you'll feel pain in a different spot remote from where the origin of the problem is. And that's why I think it's important that anytime you have back pain or even hip pain or anything related to your joints, you should see an orthopedic surgeon or a spine surgeon, because then they can identify the source of that problem and they can recommend conservative management to address it, even if that's just, these are the exercises that would be most effective for your condition. So I think it's very important that you go to the person that has the most knowledge in that field right away, and be really careful about rushing to surgery, because those of us who are conscientious are trying to do conservative treatment first. Now, there are people that come to us who immediately need surgery because the spinal condition is so deteriorated, or the nerve condition or function is so abnormal that they're a candidate for surgery off the bat, or they've had years of failed treatment, conservative treatment, and now it's time to do something more definitive.
Just a good transition as far as this question is on that topic. Do you recommend laser spine surgery to your patients?
Laser spine surgery is one of those things that has become more prominent because of the social media and the marketing aspect of it. The company that created, the biggest, draw towards laser spine surgery is a company called the Laser Spine Institute in Florida, and it was started many years ago by an orthopedic surgeon. And I would say, laser spine surgery is one of those things that does generate a lot of interest from patients, because it sounds like it's cutting edge. It's one of those new things on the forefront. But in medicine, we have a saying, never be the first or last to do anything. And what that means is that even as a patient, you have to be very careful about the types of treatment that you put your body through. Sometimes things sound really good from a marketing perspective, and sometimes there's a beautiful commercial that draws you in, right? So you have to be really careful. I think that laser spine surgery has its place, but most surgeons that are trained at programs like Mayo and Hospital for Special Surgery and the bigger programs don't routinely perform any laser surgery at all on the spine, because the risk with laser surgery is that you can have a heat injury to the nerves, which is permanent. Spinal fluid leaks. There's a lot, and there are a lot of conditions that aren't even a candidate for laser surgery, because laser surgery specifically is a discectomy. A discectomy is a surgery we do when a disc tears and moves out of position into the spinal canal where the nerves exist and pinches the nerves, causing leg pain. So if you have primarily leg pain from a disc herniation, you want to remove that herniated fragment, and that can be done many ways. One of those ways is to burn the disc tissue with a laser, and the other way is you can use microscopic tools to remove it, which is my preference. And the reason I like the microscopic approach with instruments versus a laser is that the risk of damaging the nerve covering is much smaller. And so I would say that the gold standard of care in the spine community is a standard discectomy without a laser.
Wow, so much to know, and great knowledge and information that you're putting out there. And there's a lot of engagement going on online right now. Miranda has 2 more questions, and I'm happy that everybody is TGIF this morning, because they're alive and asking these questions. Well, Miranda, what's the next question?
Dr. Olatuda Adatona from Practical Approach Pediatrics says, do you see pediatric patients, and if so, do you see patients with scoliosis?
I do. My training at the Mayo Clinic, fortunately, it kind of trained me. Okay, I'm sorry. So the question was, a pediatrician, local pediatrician, thank you very much for asking, asked if we see pediatric patients and if we treat scoliosis. And the answer is yes. My training, though, however, is specifically adult-based. So my fellowship at Mayo was an adult spine surgery fellowship, which means that I treat anyone from 15 years and above. So essentially an adult-sized child and then adults. There are some really talented pediatric orthopedic surgeons in town who do really good work, especially when it comes to scoliosis. And if there's people in town that you're not happy with, I think you can find one for sure. But there's also a place in Dallas called Texas Scottish Rite who does amazing pediatric deformity surgery. But I do deformity surgery on adults, and I do deformity surgery. Scoliosis is considered a deformity, but I do that type of surgery on 15-year-olds and above.
Thank you, Dr. Adatona. He's actually my pediatrician for my
Awesome.
my daughter. So thanks for tuning in and watching. Giving him a shout out real quick. He's a great doctor.
Awesome.
There's another question that came in, Miranda.
Excuse me. Which one weight or body resistance training exercise strengthens the back or spine?
So the question is, which one, that's a tough one, which one exercise, weight resistance exercise, is best to strengthen the back or the spine? And I would say that in general, there's probably not one exercise, because the spine is a host of muscles that surround our torso and eventually connect to our pelvis. So if I had to pick one exercise, I would say probably a row. A row is probably an exercise. Now, if you're not careful, doing rows can actually injure your back. So you have to use really good form, and you don't want to throw the weight around. And in general, I've lifted weights since I was 14. I was a football player. But in general, you don't want to ever do a lot of cheating sets. A lot of people recently with new fitness crazes have begun to throw weights around and use
Like CrossFit.
Well, and CrossFit, honestly, Miranda's actually an amazing CrossFit engaged person. But when you do CrossFit can be very effective, and it most certainly builds muscle mass, no question about it. One of my friends is the top-rated CrossFit guy in the world. He's number 20 in the world, and he's almost 60 years old. He's in amazing shape. So CrossFit can be effective, but CrossFit can also be injurious. If you're not careful, you can injure yourself with any exercise. So if you're going to be a CrossFitter, then just make sure you're using good biomechanics. Form is everything. You don't build the muscle as well if you're not getting a full range of motion, or at least a partial range of motion where you're going to strain that muscle under a constant amount of tension. And you don't want to throw the weights around. You can do a thing called cheat sets, which is something that Arnold popularized in the 70s when he was huge and everybody was listening to what he had to say. But you can cheat every once in a while, but you have to be careful, because the spine under that strain can fail. And as we get older, the risk of our cartilage and our discs, our joints becoming injured, our shoulder joints, our knee joints, our discs in our back, the risk of that injury goes up as we get beyond 20 years old. So yeah, when you're 20 and you're able to throw those weights around, and you can maximally benefit on a muscular standpoint from those exercises, that's fine. But the problem is when we hit 30, remember I said about 35% of us at between 35 and 45, and I'm actually beyond that now, but between 35 and 45, 35% of us have arthritic changes. So if you're throwing those weights around and you have a dried out disc, which is one of the things that happens with arthritis, that disc now becomes more like jerky than steak, and it can tear more easily. And when you tear your disc, the cascade of degeneration speeds up. So weight training, I would say in general, is good, but you have to be really careful about your mechanics.
Thank you so much for the questions that are coming in. Was there any more before I move on to the next one? Or?
One last one.
Okay, good.
Are you board eligible or board certified?
So the question is, am I board eligible or board certified? I am board certified, and the way that the process works, when you do a residency in orthopedics, I'm going to tell you how it works for orthopedics because that's my background. But the way it works for us is that when we finish our residency, which is a 5-year training program after medical school, we go college, 4 years of medical school, and 5 years of orthopedic training, and then spine training is another, at least an additional year, if not 2. But in order to become board certified, you have to be first board eligible, which means that you finished your training program and now you're able to sit for the written board. So you've graduated from a qualified program and now you're board eligible. So that means that you can then take the written board, and so when we take a written exam, if we pass the exam, then for us what we have to do is 2 years into our practice, and that means if you do a fellowship, then it's after your fellowship, 2 years after your fellowship. If you just finish residency, then it's 2 years after your residency. But in that 2 years after you finish your training, then you collect all your cases and you send them to the board, and the board then reviews all your cases, and if they think that your cases are qualified, then you can sit for an oral board examination. And so what happens is they pick cases for you to come defend. You did these surgeries. They pick them. You go to the board and you sit in front of an esteemed panel of honestly famous academic spine surgeons, in my case. And they quiz you on everything you've done and your indications for surgery, and they get a feeling of how qualified you are as a spine surgeon. And if they feel that you're a safe surgeon and you have credible training, then you can pass that board examination, the oral examination, which then means you're board certified. So I am board certified.
Wow.
I've been board certified for 11 years.
You know, and I'm happy to hear that, because it confirms on your patients, the reviews that I've read, and other physicians as well, as far as your success rate. And that leads into one of the questions I'm going to have, as far as you have a very high success rate. Yeah. How would you contribute that, obviously, to your education, your experience of 14 years?
I've been a spine surgeon for 14 years, yes.
And one of the questions in leading into that is your success rate of spinal fusion surgery.
Yeah, you know, that's an important question, I think, you know, and all of us, no matter who we are or where we trained, even the guys that trained me, who I respect more than anyone in the spine world, have had complications with surgery, because, frankly, surgeons are human, right? So when you have a surgeon or a doctor who's human, they make potentially human mistakes, and even when everything is done correctly, sometimes there's a problem with compliance on the side of the patient. So complications can happen. And even when everybody does everything right, still things can happen. People can get infections. The risk of that is about 1 to 3% in general for spine surgery. But the risk of complications is smaller and smaller when you go to someone who's properly trained and who's very conscientious. So if you go to someone who has fellowship training from a good program, and who's not fellowship trained but who's very conscientious and just in general talented and careful about what they do, the complication rates are pretty small. But I would say that my success rate is, I've been really blessed to have great success, and it does come from a lot of things. The foundation of where I trained, of course, is everything to me. When I decide what I need to do on a patient, I have a very complicated set of algorithms in my head. When I see a patient with this symptom following with this finding, and I put all the studies together, I do a very thorough workup, and then identify the problem. A lot of times people are looking only at an MRI, and there's definitely not enough information from an MRI alone. There are a lot more specialized tests that we have to do to identify everybody's individual problem, and every problem is distinct. Patients who have a friend who had this or a friend who had that, don't think that that's the same thing that will apply to you, because it may be a very different diagnosis and subsequently a very different treatment necessary for your treatment, effective treatment. So my success rate in general is about 98%, and I'm talking about a clinical success rate of about 98%. Clinical success means, did the pain get better? Did the problem get better? Now, that doesn't mean gone. No, there's a difference between total relief and a cure and success. So when I talk about that, I mean people are better when they came. Now, not everyone is going to get better, and there's a host of things that can lead into that. And there's about a 2% potential of that. But in general, the published success rates in spine surgery, unfortunately, are around 50% across the nation, which we need to work on. We're working on that, I think, as a community. And I think doctors in general are conscientious and they want to improve that, but mine is about 98% in general.
Well, thank you so much for answering that in so much detail, and for your time this morning, this Friday morning, and putting yourself aside, because you can sense a passion behind what you're doing in your profession and your craft. It sends a message to everybody else that you actually care for the patient, making sure that the results, the 98%, is because of the passion and you care about exactly what you're doing. Obviously, there's homework that as we spoke with prior, that the patient needs to do to maintain that type of success as well too. So you do send everybody with information on what they need to do to go ahead and complement that, correct?
It's a team approach. You can't have a surgery success without a patient who's willing to follow the restrictions or the rules after surgery. You can have a perfect technical procedure followed by non-compliance and a total disruption of the success of the operation. So it's definitely a team effort. The doctor has to do a good job. The patient has to follow the rules. And if you put those things together, it's very common that people will have success. I think that one of the things for me that drives what I do is recently there was a post where I said, I serve God, so I work really hard to do a good job for my patients, and this is true. And there was a physician who commented on that statement, and it wasn't something that I published. It was actually something that you guys published from what I had said. And that's the truth. Is my faith and my beliefs in God do create a drive for me, a constant drive to do the best job I can for every patient. I treat them like they're my friends, my family, or myself, because I want God to be proud of my efforts in this life. And I can't separate that from myself. A lot of doctors don't want to talk about faith, but faith is part of who I am. and it's what drives me to do an amazing job. It's beyond the Hippocratic Oath. The suggestion from this doctor was, you already have to follow the Hippocratic Oath. I do, but my faith drives me beyond the Hippocratic Oath. So I think that's an important
spiritual healing, isn't it? It's very important, and thank you for sharing that with us. You know, as far as a patient, just to end this segment, and thank you everybody who's tuning in. Would you have any more questions, Miranda? We're good. Awesome. As far as how can a patient reach you? Is it through their primary physician? Can they self-referral? Can they give you a phone call, or how does that work?
Well, it kind of depends on your insurance. If you have a PPO, you can certainly reach out to us directly. Our phone number is 210-487-7463, or that's 48 Spine if you want to remember it easier. But it's 487-7463. Our website is www.saspine, like SanAntonioSpine.com. You can certainly call or email in a request for an appointment. But if you have an HMO, then you do need to get a referral from your primary doctor, and they could send a referral over to the Orthopedic and Spine Institute. We are the Orthopedic and Spine Institute, and we're on 8401 Data Point Drive, Suite 700 in the Medical Center in San Antonio.
Well, there you go. You heard it from the expert yourself. 30 minutes of Q&A. This will stay online. Indefinitely. If you have any questions, we could always refer them back to the doctor even after the segment is over. Ask away. Thank you so much for tuning in. If you have any other questions as far as MD Monthly, Facebook, social media, if you have a doctor you want to recommend who you think we should go out and interview, please feel free to contact us. We will reply back and see what avenues we can take on that too. We are as smart as the physicians that are with us, so our substance is our colleagues and everybody that we're promoting. I want to thank you so much this morning for your time. I really appreciate that.
Appreciate it.
Thank you, guys.
Have a safe weekend.
Have a great weekend.